Guadalupe y yo estoy trabajando para Healing Grove. Yo soy la persona que les llamo para darles la noticia, ¿verdad?, de que han salido positivas a las familias. Y bueno, esta semana hemos trabajado muy duro, hasta 10 horas llamando con las personas. Nos hemos estado dando cuenta que han salido positivas a personas en las familias antes y que han tratado de contactar al condado y que no han recibido ninguna respuesta. Estamos escuchando a las familias muy frustradas, muy tristes. Nosotros no sabemos qué responder porque ellos están desesperados por ayuda. Entonces nosotros queremos que este proceso sea más fácil para ellos, ya que no tienen accesos a correos electrónicos o alguna forma, a veces a una computadora. Por favor, pedimos que hagan más fácil este proceso. Es muy frustrante y solamente podemos decirles que rueguen a Dios.
Thank you, and we'll allow a minute for translation.
Hi, I'm working with Healing Growth, and I'm the one calling to give the news for people that are positive in families. And we've been working very hard every day, up to 10 hours a day, and to let people know they are positive. And right now, we are trying to make contact to with different people, and we don't know what to answer to them because families are still feeling very frustrated and are very sad. We don't know what to answer to them, and they need help. And we just want you to let you know that this process should be easier. Sometimes people are not even having email access or computer access. They need easier ways to let them have contact. They are feeling frustrated, and please provide some solution.
Thank you. Brett, do you have any additional speakers who were unable to connect otherwise? I have you muted. Can you unmute yourself?
Estoy dándoles información, ¿verdad?
Sorry, can you please start again?
Positivo.
¿Puede comenzar otra vez, por favor?
Buenas tardes, mi nombre es Adriana María y yo estoy dándoles información, ¿verdad? Mi esposo salió positivo para COVID noviembre 20 y a partir de esa fecha hemos estado tratando de contactarnos con el condado para que nos ayuden con lo que es la renta. No hemos recibido ninguna respuesta, ya mandamos todos nuestros correos que necesitábamos. Entonces, bueno, se nos está haciendo un poquito frustrante esto porque no tenemos respuesta alguna. Y bueno, queremos saber si es posible que nos ayuden, ¿verdad?, de una manera más fácil, ya que es un poco difícil para nosotros los correos y todo este tipo el proceso que ustedes llevan. Entonces, esperamos una respuesta y muchas gracias.
Thank you. We'll allow translation.
So my name is Adriana Maria, and I just want to give some information. My husband was positive on last November 20, and we have been trying to contact the county, and we need help for paying the rent. We have not been successful. We are not having any answer. We provided all emails. This is very frustrating. We haven't had any answer yet. And we just want to know if you're able to give us some help. And also, this should be easier. I mean, we are not having access to emails, and your process is difficult. So we need you to give some answer. Please let us know if you're able to help. We need some answers.
Thank you. Brett, I'm asking you to unmute again. Do you have any additional speakers who were unable to connect?
Salí positiva de COVID desde octubre 28. Me dieron un número para que hablara al condado y poder tener ayuda alguna porque estaba sin trabajo, ayuda de ustedes con renta o qué sé yo con algo, y pues desde entonces todavía no recibo ayuda. Es muy frustrante que uno hable y decir no estamos ocupados, te regresamos la llamada, esperar la llamada y que nunca regresen. La verdad que uno cuando tiene necesidad y está y sin trabajo, hijos que mantener, uno espera una ayuda de ustedes, una ayuda pronta, ayuda rápida para que uno ayudara a solventar sus problemas. pero con ustedes es bien frustrante porque no regresan la llamada pronto. Conmigo quedaron desde la semana pasada que me iban a llegar una tarjeta, que tenía que hablar, que me mandan para allá y para acá, y la verdad pues todavía no recibo ayuda alguna. Y pues sí, estoy desesperada. Necesito saber a qué número uno puede ir o dónde puede llegar uno ya personalmente, dejar.
Thank you. Rosario, were you able to get that?
Yes. So I was positive on COVID on October 28th, and I was given a number to call to the county, and I have no job. I wanted to ask for some help for paying the rent, and I haven't received any answer. I haven't received any help. I'm feeling very frustrated. People say they are very busy and they will be returning my call, but nobody's getting back to me. I have no job. I have children. I need some help really quickly, and I need to solve this problem, and I need you to help me, please. I'm feeling very frustrated. Nobody's answering my calls. And last week, somebody told me or that I was going to receive a card with a number to call. I've been coming from here and there and so many places. I don't know where to call right now, and I just need some help.
Thank you. Brett, do you have any additional speakers with you?
Yes.
Can you just give me a heads up how many?
I have one, one more, two more, one more Spanish speaker and Dr. Bymaster.
Thank you. Go ahead.
Me salí positivo el día viernes, me llamaron y me dieron un número para que llamara yo al condado para yo pedir ayuda. Necesitaba yo alimentos o ayuda con la renta. Llamé y me contestaron del condado y me mandaron una aplicación que me pedían unos documentos que mandé. Eso fue la semana pasada y volví a llamar al siguiente día para ver si había llegado el correo que había mandado y me dijeron que me iban a regresar la llamada y pues hasta el día de hoy no sé nada pues acerca de la aplicación o si me van a poder ayudar o no. Todavía no sé si voy a regresar a trabajar. Supuestamente tengo que estar toda esta semana y también hay otras personas de quien digo yo que también salieron positivas, entonces no sé cuánto tiempo voy a poder yo estar aquí y no recibo respuesta yo del condado acerca de la aplicación que yo mandé.
So I was positive last Friday, and I was given a number to call and to make contact with the county, and I need help with food, and I need help for rent. There was an app I downloaded, and I sent some documents, but this was last week. And I also called the following day just to make sure the documents arrived, and they say they were calling me back, but nobody has called me back yet. And it's been a week. I don't know what happened in the app. I don't know if I'm receiving some help. Nobody's getting back to me since last week. And I know others in my job were positive too. I don't know if I'm going to be able to go back to work. I know now I'm not able to go back. So I just need some help. I just need to have an answer. Are you able to, is the county going to be able to help me? Thank you.
Thank you. Dr. Bymaster, go ahead.
Hello, my name is Dr. Angela Bymaster. I'm a family physician at Healing Grove Health Center, and I wanted to comment about the COVID positive funds. These funds are essential to decrease the spread of COVID as workers are turning positive. They want to go to work because they need to pay their rent. They need to take care of their families. And we need to give them the money right away so that they can stay home and that they have the confidence that they will get paid. So that they don't sneak out and go back to work. We need the money to get out, and we need it to go there fast. Right now, it's really not happening, and patients know that, and so they don't have any confidence that these funds are going to actually get to them. So we are requesting that community clinics can have access to the funds to hand to the patients. The clinics already know who's positive, and they have the abilities to get the money to them fast.
Thank you. Brett, can you confirm that was your last speaker?
Yeah, that's the last one. And Marie Marcelo should be logged in from her phone. So that with Maria, that's it.
I have two names, duplicate names under Maria Adriana. Is that the person who already spoke?
Maria Adriana already spoke, yes.
Thank you. I'll remove those requests. Thank you, Brett.
Okay.
All right. Galaxy Note 10, perfect. Go ahead.
¿Aló?
Go ahead.
Sí, buenos días. Mi nombre es María Marcelo. Y la verdad yo estoy bien preocupada. Soy directora aquí de Healing Grove y estoy tan preocupada. Realmente no sé si estoy enojada o preocupada porque veo que el sistema que tienen para la ayuda de las personas del COVID no está trabajando. Tenemos día a día personas que llaman molestas, frustradas, lloran con nosotros porque dicen, salimos positivas en marzo, salimos positivos en octubre, no nos dan ayuda. Una señora habla hace una hora nada más llorando diciendo que no tenía para la renta, no tenía para comer, y que había pedido ayuda y el condado le había dicho que le iba a marcar después y no tenía respuesta. Entonces dice ella, ¿cuento con el condado o no cuento? Yo necesito saber quién nos va a ayudar. Díganos, por favor, quién nos va a poder dar la ayuda. Entonces necesitamos que este sistema se cambie y se ponga en función para toda la comunidad, sobre todo para los que no hablan español, inglés.
So my name is Maria Marcelo, and I don't know if I'm angry or am concerned. I've been asking for help for this COVID situation, and I don't know what to tell people anymore. They are feeling frustrated and they are feeling angry all the time. Some people that were positive on March, all others in October, and an hour ago I just had a lady crying because she needed help for rent and for food, and she called to the county. Somebody said they were calling back. They never called back, and I'm feeling angry. I don't know what else to say. Is the county going to help or not? Or who's going to help with this? Your system is not working. We need the change in the system, and we need support mainly for the Spanish community.
Supervisor Chavez, and thank you very much for your partnership on this referral. I know in our discussion over the last many board meetings that we both expect to see a very strong and effective isolation support program that supports our most directly impacted residents. And as many of you know who may be listening, I've raised questions about our plans and processes for the isolation support program since June of this year, and we have made some important progress in engaging cities to partner in this work and in standing up various types of support. But we've also experienced very concerning ongoing backlogs, difficult to navigate systems that have at times delayed access to critical supports to residents. I'm very concerned by the data presented here and in yesterday's off-agenda report and in today's San Jose Spotlight article. While this isolation support program is grounded in the county's role as a safety net provider, this is also a critical tool to reduce transmission of COVID in our community. We can't expect infected residents to stay home from work if they don't have the resources to pay their rent or feed their children, and we can't expect our community to lower transmission levels if we're not making sure infectious residents are able to isolate. And as a county organization, we can't claim that we're doing everything we can to reduce transmission and continue to increase restrictions through public health orders, but then be complacent with a system that is too slow and presents too many hurdles to actually help people stay at home while they are infectious. And if we expect businesses and workers to sacrifice under the public health order, I also expect maximum responsiveness from our county team to implement the necessary support programs and engage effectively with community partners. This program is essential to our response. And at this transition point in the contracts, and with the current surge still gaining momentum, I expect meaningful consideration of areas for improvement to come forward in the January report. The referral was written with a view toward how we would improve and expand the program in 2021. And I just want to be clear that I'm asking for reflection and planning for improvements, not just a report back on the current status, which should include consideration of a decentralized model that leverages community partnerships, as we've done with community-based testing and we've done with embedding contact tracers with some of our CBOs. So In addition, and to sunshine from my colleagues, I've been in discussion with Dr. Smith regarding how we can expedite supports to residents right now, especially with the CARES funds that have been committed by the City of San Jose, our largest partner in this program, that are due to expire at the end of this month. After months of asking for data and hearing the stories of constituents at today's meetings, I really felt appalled by the off-agenda report we received yesterday that shows that less than 40% of the residents who have been referred since the start of this program in June have received assistance. And on average, assistance takes 40 days. This is far, far too slow to achieve the intended purpose of the program, and risks are having to return millions of federal CARES funds that were entrusted to us by the City of San Jose. And I do appreciate that the times have improved in November. We're now down to 12 days for San Jose residents, 18 days for other cities. But again, with this current surge, I'm really concerned that we're not ready to keep up with demand and further reduce the disbursement times. The remarks from the speakers today who have tested positive in the last few weeks is demonstrating that we still have significant unresolved issues. The slides today, I don't have the number of which slide, show that just $837,000 have been distributed since June by our county program, but the City of San Jose allocated $4.5 million for this program. I am really concerned about the ability of our staff to distribute aid to nearly 700 COVID positive residents in the next 3 weeks, when only 440 have received aid over the past 5 months. The county charged our city partners an administrative fee to run the program, so the responsibility rests with us to make this work, not to deflect to San Jose requirements or the Sacred Heart backlog. This is really on us. Healing Grove is another organization, and right now in partnership with Destination Home has come forward, as we heard sometime this afternoon, with an offer to process and distribute funds to about 500 of their patients who have tested positive. Dr. Smith last week committed to supplementing that contract to process isolation support cases, and Dr. Smith, thank you for that. This was with the intention that Healing Grove would submit applications for payments to be dispersed by the county team utilizing the San Jose CARES funds or other existing funds from partner cities. But given that we have less than 30 days left to clear the backlog of cases and the slow performance documented in the off agenda, I want to make an additional motion today, in addition to asking for approval of the referral. I'd like to add to that administration transfer existing isolation supports that have been provided by the City of San Jose up to $1 million to Healing Grove to distribute to qualified COVID positive cases and close contacts, and execute the pending contract extension to fund admin costs along with this transfer ASAP, and report back to the board at the next meeting. This again is a new request separate from my referral with Supervisor Chavez. I don't want to put words into her mouth, and it builds on the amendment to the contract that Dr. Smith already committed to this effort. Please note that this motion does not add any new funds, only a pass-through of up to $1 million of already allocated isolation support program funds at no new cost to either the county or the City of San Jose. We checked.
Can I stop you there just because that's a motion. So you're moving item 15 with this additional additional request. Okay, I'm going to second it for purposes of discussion. But Susan, can I stop you there just for a moment? Is that your whole motion?
It is, but I just want to finish my explanation and circle around to why I think that this is necessary. City staff has indicated, San Jose, that decisions on the mechanisms to distribute the funds is up to the county to determine. The change won't require an amendment to the city-county contract, and this is only a short-term effort to assure that we don't leave funds for this program on the table to be returned by San Jose to the federal government at the end of December. I really do appreciate the commitment and the effort of our response team, the hard work they're doing, especially through this surge. But I also have to push hard to assure that this program meets the core purpose of getting aid into the hands of infected residents as quickly as possible and preventing further transmission in the community. So summing up, my motion is to approve this referral for 2021 planning with the addition of additional direction to pass through support to Healing Grove to expedite distribution of funds to their patients.
So before I go to colleagues for comment, what I wanted to do was just let staff respond to the new part of the motion, and in particular, Supervisor Ellenberg, the big question I want them to be able to respond to is, will the requirements be the same for Healing Grove as they are for us, given the source of the funds?
Yeah, they should be identical.
Okay, the second part of that is, will there be other monies that are left on the table based on the speed we're going at right now, even with the change that Supervisor Ellenberg is recommending?
Good. Let's find that out.
Yeah, and I'm not sure who to ask. I've got lots of boxes and no faces, so I'm reading.
I think I'm probably best to answer that. In order to accomplish what you're suggesting, we would have to come back next week with an accounting of the monies that were transferred from San Jose. I don't think there's still $1 million left, but we'll have to find out and come back. And
Dr. Smith, there should be, if only $837,000 have been distributed, there should be well over $1 million left.
Well, I'm not going to.
How would that work?
Well, I guess what I would say is I have to be sure that those numbers are all correct before I put in an F-85. So
okay, the numbers were presented on the slides and in written reports to us, so that would be a huge concern of its own if those numbers were not correct that we were given.
Well, either way, Supervisor, we have to come back with an F-85. So what I'm saying is we'll come back with an F-85 and a rendition of allocation of all of the monies that came from the city of San Jose, so that we can all understand exactly what was spent on what. So,
right, and again, this critical piece is we don't want to leave anything on the table to be given back to the federal government. There's clearly tremendous need in our community, and our biggest challenge is just getting out of our own way to get the money out of county government and into individuals' hands.
Right, couldn't agree with you more. We don't want to leave a penny on the table. We want to make sure we've spent it all. I want to make sure that I know exactly how much is there. And also we need to improve our processes. And if we're going to do a $1 million grant to Healing Grove, we'll have to enter into a contract with all the conditions that you specified, that it would be the same kind of process. So
again,
give us some homework to do, so we'll be back on Tuesday with the homework done.
All right, good. And again, the goal is getting this money out, and my concern is if we don't get it out in big chunks to a CBO that can distribute it quickly, we don't have any history of showing that we can get the rest of this money out by the end of the year.
So Supervisor Ellenberg, just to follow up, Dr. Smith, with you and Kian Consuelo, I think that in addition to any F-85, I think one of the questions that really needs to be answered is based on the resources we still have available, concretely, what is the plan to make sure those resources that must be spent by December 31st are in fact spent by December 31st? And to be frank with you, one of the challenges that we have, even with a new partner, is if the requirements are the same, they're going to have similar challenges, I think, that we may be having.
A difference.
Susan,
Sorry.
I'm sorry.
I'm sorry.
If I may.
My apologies.
The difference may be that the expansion of the staff and the volunteer team that they have, so there are more people, Dr. Smith, but I do, what I guess I also want to make sure of is if there are people in process that we're not removing resources from one pot if we've got people that we're moving on. So if I could, Supervisor Ellenberg, I just want to make sure the staff has the flexibility to come back with something that meets the goals,
Yeah,
even if it's
absolutely.
not exactly the way we just said it. Okay.
Yes, no, of course, we can't take away any money that's in process, and we might have money for non-San Jose residents as well. Yeah, absolutely. Achieve the goal, whatever the best way is to get there.
Great.
Yeah, I can also add that some of the money was spent on hotels, which wouldn't be reported in the numbers that you just saw in terms of the short-term financing. So again, we'll give you a complete accounting of where everything is, what's been spent, what's not been spent, and how we can make sure that we get every cent spent and what we're doing to improve our processes. And, you know, if we have until Tuesday, we should be able to get that for you.
Thank you so much.
Thank you. I'm going to